Hello, happy Tuesday.
Happy Tuesday. I'm Alina. I did it first.
And I'm April. Welcome. We're so glad you guys are here. We are sisters and doulas and childbirth educators, and we come weekly to share some great pregnancy, birth,
And beyond
information
and stuff that you might not know.
Or we go like a little deeper into things that you might want to consider, or
Yes.
There's lots of things. So
it's all about options. When you know you have options in birth, then you can make different and better decisions.
Yes. So we are so happy that you guys are here to join us. We are live, and
hi everybody.
We've got some good people join in so far. So
Yes.
We're so grateful for you.
And we are sorry for our Facebook community. Facebook is not working for us, so we're trying YouTube Live.
I'm not sure if you guys know this, but we have a YouTube channel.
We have a YouTube channel
that we actually take these lives from Instagram and Facebook and we upload them to YouTube. But now we're just going live on YouTube.
We're trying it out. We're trying
so that it has so it can live forever. Because don't you want to hear us forever? So.
Forever. Yeah, and we're just gonna hop into it because I mean, do we want to talk about what we've been working on and why we look the way we
it's serious Greece situation going on.
We, just so you know, we've been working for 2 weeks now.
For months, but
for months, but from 5 o'clock in the morning till like 9 o'clock at night.
Maybe later. Like last night, I went to bed at midnight.
Yeah, you're right. And me too. But in there's like, we're taking care of kids. But really, we work from 5 to midnight every day for 2 weeks. And
to get this course going. Okay, it's awesome. This course is so good. But it's been interesting so the course is done. It's just now like getting all of the tech side of things working and the way it should be. To get it to you guys. So we were hoping to have it we were hoping to have the cart open this week, but I think next week.
We need 1 more week.
I think, because we're out of babysitters.
Yeah, we're out of babysitters. No one wants to babysit our kids anymore.
So I have to wait until Saturday and Sunday when the husbands are home.
Yes.
But
so hence the 5 a.m. look. With the little poof right here. Going from one thing to the next. So we'll just jump into it because we're so actually
it's a favorite
she's
topic.
Excited.
I am.
I'm like super pumped. I love this.
This is one of Alina's specialties.
Pet ideas. Well, I just love the science. I love this science of mind-body connection and how everything is always connected and how we can utilize that mind-body connection in labor and make it work for you in amazing ways. So we're going to get into it. We're talking today specifically about breathing, how breathing techniques can work in labor. So,
which is important.
Yeah, it's super important. So will you guys, if you have any questions about breathing or experiences about with your own labor or people that you've heard of or whatever that have used,
throw them in. We'd love to bring that information in and share with everybody. And the thing is too, is breathing is, you'll probably get
talk about it. It's okay.
But breathing as doulas is one of the biggest things that we remind moms to do, because it's kind of like our natural reflex to just like tense up and stop breathing and we don't even notice it.
And it's in the stopping of the breathing that cascades a whole series of things that happen in your body.
Okay, I think you should get into that.
Let's just talk about it right now. It's hormones, it's nerve synapses, it's all the things. So what happens is when we perceive, so first we have a thought. In our amygdala, in our limbic brain, we have this thought that says, I'm worried. Yeah, I don't know. If I get too sciencey,
I will translate. Go ahead.
Will you?
Yeah.
Okay, guys, stick with me.
In a part of your brain.
There's a part of your brain that has thoughts, right? And so you think, this makes me nervous, or I'm worried about this. And your body physiologically responds with breath and you stop breathing. You hold your breath, or it becomes really short and shallow, and you're taking rapid breaths. So holding your breath or slow rapid breathing immediately tells the sympathetic nervous system, oh my gosh, get worried, get tense, and
that's a response from the fight, flight, or freeze. Like that innate sympathetic. Is it sympathetic?
It's your sympathetic nervous system will fire, and it's like, hurry, get the adrenaline out, get all the scary things.
Tense up. All your muscles tense up, even like the muscles right under your skin, right? All of the hairs are now up. You are ready to go.
You're ready to go.
Which means,
and all you did was have a thought of something that might worry you or scare you, or that you're not even feeling pain, but you think you might be feeling pain. And so your body is reacting as if it is feeling pain. Is your mind blown?
Just
by
your breath. Stopping your breathing.
Or shallowing your breathing. So it's that all happens instantaneously. And it actually is through the vagus nerve, which...
Have you heard of the vagus nerve?
Are you ready for the vagus nerve? I'm going to tell you, we're going to get through breathing first. And then as a bonus, we'll talk about the vagus nerve, because the vagus nerve
it's really cool, you guys. Cool. Our bodies are so stinking awesome. And if you understand the way they all work together, all the parts, all the chemicals, everything that's inside of you, without even thinking about it, the design of everything that's going on, it is like, you're just magic. Like, you can't help but be like, dude, that's me.
I got the best body ever. So that's when you perceive warrior attention. So if you notice you're shallowly breathing and your heart's starting to race, you're getting a little sweaty, things are happening in your body, all it is another thought, a decision to slow that breath down. Because you have control. So our breath it's so cool. Like, it's something that we do without even thinking about it, but when we stop and think about it, it can change everything. And when we can stop, get ourselves in the present moment, and take some deep, slow breaths.
And that's something I think we need to bring into.
Everything changes.
Is there are different ways of breathing.
Oh, there's hundreds.
Like it's not just like, oh, take a breath, and it's just regular breathing that you're not thinking. Like, there's lots of different ways of breathing, and they accomplish different things within the body, which is super cool. And practicing those things will do different things in your body. And you can condition your body to do those things, like for example, your lung capacity. You talk to any singer or swimmer, and they have elongated their lung capacity because of the type of breathing that they do.
And why they use and how they use their breath. So that's really cool. Yeah. What a good connection. So should we take some questions or comments?
We have some really cool things. So
I think it's down.
So Whitney said breathing through contractions was the only thing that got me through it. It's true. It's
well, and we'll talk about that. That breath cascades all kinds of things that happen to be able to get through those contractions. So thank you for talking about that.
And then another Whit said, at a birth class before I had the baby, they told Dad to breathe on our foreheads to help us concentrate.
Ooh,
to help us concentrate. It helps so much.
Cool.
That is way cool.
So breathe onto your forehead.
I've never done that, but I feel like that's a doula trick. I feel
like we should figure that one out and do better. Thanks, Whit.
Awesome. And Ashley said, inhale for my baby, exhale for me. It was a mantra we did in prenatal yoga and was super easy for me to remember in labor. I love it. That's an affirmation for baby.
Well, okay, you know what's really cool about that is a mantra, but that's like actually super amazing life force. Okay,
like what's happening,
like symbolism, because so part of why breathing is so important during pregnancy and during labor is because your body has another human being that it needs to supply oxygenated blood for. So not just yourself, but for your baby. And so when you inhale and you're having these deep breathing and when you're filling your lungs all the way, and specifically your lower lungs, it's in your lower lungs that most of your oxygen receptor sites are in your lower lungs. So that's part of your body's cascade of fight hormones is when we have shallow breathing because we don't have enough oxygen.
And okay, do it. I want you to try it.
Yeah.
So when she says lower lungs, just show us.
It's abdominal breathing. So if you have your hands on your belly and you breathe in, your belly should get
in the bottom.
Yeah, your belly should get nice and big. And then exhale. And your belly, if you focus on your belly, it's in
the diaphragm.
Yeah, it's in your diaphragm. Yeah, that it's mostly your diaphragm, but if you can't help but also inflate your chest fully.
Okay. I remember you teaching me a breathing technique where you breathe in the lower lungs first.
Yeah, you fill up your lower.
The medium lungs,
middle. Well, it's a visual exercise. You fill up and then fill up and fill up
the top.
And so it just is a way to, and then you let it all out. So interestingly, the reflex of your body to breathe is actually not that your body, it's your body needing to get rid of the CO2, not necessarily that you have too much oxygen. Your body can never, it loves the oxygen. So even that space at the top of an inhale,
where you hold it
before you exhale, that's important. It's the holding of your breath for just a moment that your body has 1 more millisecond or 2 more seconds to absorb oxygen
into the bloodstream.
Okay,
Whit also said she'd love to know about breathing while pushing, and she said she's heard mixed things about hospital coach pushing. We'll go through that.
Let's talk about it. That's actually a big part of our course.
Yeah, it is.
Is breathing and pushing.
I love when I do slow, deep breaths, help my baby to change his breathing pattern when we are snuggling. That is so cool.
That is a thing.
That is way cool.
That is.
I love that. My birth story is nuts, and although I wanted to intervention, no intervention. I needed all of it, but breathing helped during my 34 hours of labor, even to help remain calm and headed to my C-section. Oh,
thank you for bringing that up.
That's huge.
Okay, so here's awesome. The thing is so I don't know did your moms do Lamaze class?
And like when you think about movies, right? That's what they're doing. They're screaming or they're breathing like that.
They're breathing weird, and it was all Lamaze, and Lamaze was kind of the first of the natural birth methods, and it's awesome. Lamaze is awesome.
They've really shifted.
Well, it's not even that they've shifted; they've honed in.
Yeah,
they were on it. They figured it out, and they just didn't know how they figured it out.
They're like, this is working.
Yeah, they refined it a little bit more. Anyway, so a lot of people think that only natural labors or only unmedicated births are in need of breathing techniques, and that is absolutely not true. And I'm super glad that Ashley brought that up. Laboring, you have to labor, whether you have a C-section or an epidural or an unmedicated birth. There's laboring that happens, whether it's Braxton Hicks, and you're pregnant, and during that pregnancy, your breath work is super important. So,
and not to mention, I love that she said it kept her calm. Yes. I have had friends that are like clients that have hired me for subsequent births that told me about their first births that they wanted a different experience with, and it was like they were so riled up. Even though they knew that they wanted an epidural or they knew they wanted these things, they were so riled up that they nervous. I had one mom that they tried to place the epidural. I think they stuck her 36 times, and it was just
serious?
Yeah, they just couldn't get it because her body was responding.
So tense.
She was not breathing. She did not have oxygen in her blood. Her veins were her arteries and veins were starting to constrict. It was just it was a miserable experience for her. So breathing. And she had a completely different experience with her second birth. And part of that was because she remained calm through breathing, through.
And used her breath.
Mm-hmm, and through mindset and keeping things. And that's the thing. Alina's going to go further into the science part of this. But when you breathe, that actually calms you down. You actually go out of the fight, flight, or freeze because you can.
Just by changing your breath.
Change that.
Chemical. And then, mostly because your muscles tighten up when you don't have enough oxygen. And so when you breathe, your body, loosens all those muscles because you have oxygen in your body. So whether you're in labor or whether, because your uterus is a muscle. So we want your uterus to do its job. And if it doesn't have enough oxygenated blood, it cannot function optimally. And if anything needs to happen during your labor is you've got to have your uterus functioning properly. So that deep, those breaths, those slow breaths.
Emily brought up a good point. She said breath work for me is really hard when I pass 25 weeks because I'm all legs. Literally, my torso is so short, 2 fingers between my ribs and the top of my hips.
Okay, so I love that you brought that up. So by the time you're 25 weeks, so that's...
Wait, she's not done. I learned with my first that practicing breathing during pregnancy helps so much during labor.
That's what I was just going to say.
Girlfriend, you got it.
You got it, Emily. You did. Thank you for bringing that up because that is our recommendation as childbirth educators. We love teaching breath work as soon as possible to
but like we're talking minutes. It's not, it doesn't have to be like an extensive like, oh,
no,
right now
it's like 5 minutes twice a day is optimal. If you can do 5 minutes once a day, awesome. Because it's a muscle. Again, you're conditioning your body to feel and to breathe certain ways.
Respond a certain way.
To respond a certain way. So when your belly is full of baby and your lungs are squished and there's not a lot of room, your body knows how to get that oxygenated blood, and you have conditioned your lungs to be able to do that. Is there another comment?
Yeah, Ashley just said that she had some trauma and her doula was a lifeline during all of that, especially to her husband. So thank you to all doulas.
Oh, Ashley, so nice. Thanks. Doulas
they are awesome. Great, and especially in traumatic situations.
They're worth it. In all situations, but especially when there's things happening. So
we are like referencing all of this to pregnancy and birth, but we hope you can understand too that breathing and breath work actually surpasses all the
and I'm going to tell you the research. They have been doing lots of studies on breath lately because of all the physiological effects. So that means like it's lowering blood pressure. It's reducing anxiety. It's helping with PTSD. It's increasing energy levels. It's helping with muscle relaxation. Stabilizing blood sugar. All of that happens.
That's amazing.
Like on a physical level, just because of
just continuing to breathe.
Yeah, just breath. So I don't know about you guys, but when it is amazing, sometimes I forget to breathe. Like I will be working or whatever, and all of a sudden I'll go, it's almost like my body was like, oh my gosh, take a breath. So, and then, sorry, I gotta nose it. So then I know that it's important for me to stop and to like realign and come back into my body.
Few deep breaths.
Yeah. So I was in my head and I don't know what I was doing, but I'm usually working or thinking about something that is not necessarily in the present moment. I'm thinking about the past or the future, because if I was in the present moment, I would be breathing and noticing my breathing. And that is actually the biggest part that science is having a hard time quantifying, but they are through like EKGs and EEGs is they are finding as people do breath work and deep breathing exercises, it will stimulate
light up the brain.
Yeah. Light up the brain in like your feel good centers and your memory. So it's stimulating memory. It's stimulating like
calm and
oxytocin. Thank you. Like all your hormones that are really, really beneficial to your system. So
that is cool.
And because it's creating a mind body connection. So, and that's where the vagus nerve comes in. Your vagus nerve is a nerve that connects your brain through the brainstem into your body. It specifically connects into your gut, your heart, and every single organ, but its main like channels are from the heart and the gut and the lungs. And then it has connections, neuron connections with every single organ. But that's why we get gut reactions. That's why when we breathe, we have emotional, physical, and mental responses
through your whole body
because of that nerve, because of those sensory nerves. So it would only make sense that breathing could calm the mind. And that's why meditation, the biggest part of meditation is on breath.
Yoga.
Yeah, and yoga is on breath.
Yeah.
And I love that. So in the yogic tradition, there's a whole section of yoga that's just breath. That's all it's called pranayama. And prana is life and yama is control. So it's like life control. Your breath is,
and you like sit there and breathe differently.
That's all you do is breathe differently.
And it's yoga, but it's just you're just breathing.
Yes.
And that's so cool. I've never done it yet.
It's so cool. Guys, it's awesome. But one thing I want to say about the vagus nerve, and then we're going to do a little breath exercise.
I did want to talk about pushing and
we got to do that. Okay. Maybe I'll not talk about the vagus nerve. Do you want to talk about?
No, do you want to?
Okay, so you can stimulate your vagus nerve. Breathing is a really good way to stimulate your vagus nerve. And honestly, so many things are, when you stimulate your vagus nerve, like so many things fall into place.
There's a huge benefit.
Yeah, but cold exposure, so like cold water.
We're talking like you're like in the shower and you put the cold water cold for like what? How many seconds?
Like I don't know, a minute.
Oh, that's too
20
long.
Seconds. Any kind of seconds. Honestly, it doesn't even matter how many. Yeah, it takes your breath away. Like that kind of cold.
That will stimulate that nerve.
Yep. It stimulates your vagus nerve. Gargling with water and gargling like that with the water in your mouth, in your throat. That will stimulate your nervous system, or your vagus nerve. Singing and chanting. So when you're at church, sing extra loud because that will help. Massaging your neck and your feet actually will help stimulate your vagus nerve. Laughing will do it. Visualized gratitude. They actually did a study on the vagus nerve, and they had people. They were doing meditation. People in meditation, so just like focusing on their breath, and then half of the group was focusing on their breath while visualizing gratitude,
like things they were grateful for. And
while they were focusing on their breath, and the other ones just focused on their breath, and the vagus nerve was stimulated in the ones that visualized gratitude. Cool, huh?
That is super cool.
And then any kind of exercise, especially yoga, obviously because of the movement with the breath, like putting the movement of your physical body with your breath is really, really helpful. And the number one way to stimulate your vagus nerve is, guess what?
What?
To relax.
Imagine. Are you serious?
No, I'm not. I'm totally serious.
That's amazing.
Because guess what? When you breathe deeply, what are you doing? You're relaxing and you're stimulating.
But not when you're in cold water.
That's true. But that is the number one way, is to relax.
To relax.
So that's
even more reason, Emily, for your husband to rub your feet more.
Yes. Oh, that's a good idea. So that's just more about how to stimulate the vagus nerve, which is one of the coolest nerves in your body.
It is really cool. And the more you learn about it, the more you're just like, I can't believe I didn't. I was just this year when I learned about the vagus nerve.
It's so cool.
So there's amazing things that we can learn about our bodies. Okay, so I want to talk quickly about pushing and breathing and pushing because especially, I will say across the board, it doesn't matter if you're home or in hospital or at a birth center, midwife versus OB, typically the coaching for when you are like ready to push is to, okay, take a big deep breath in, put your chin to your chest and hold, push, hold, keep holding, hold. Good, push, hold. Good. Okay, now another deep breath in, put your chin to your chest and push, hold. So that's typically the coaching. And sometimes you'll get nicer nurses that are like, hold to, and they'll count you through for like 8 to 10 seconds. So, but the thing is, the reason why they do that is it is effective. They do get results with the hold and push and push and push and push. And
okay, finish, and then I'll say no. Finish.
Which is fine. Like we want you to know that if you pushed your baby out that way, that's totally fine. But
sometimes that feels the best.
Sometimes it does.
Honestly, at some births I've been to, I've been helping them. April will tell you how like the most effective way to breathe. Yeah. And I've taught my clients like this is the most effective way to breathe. And then they'll get to a point where they're just holding their breath. And I'll say, okay, come on, breathe with me. And they'll say, no, I want to do this. And I say, awesome. Keep going.
Do what you want then.
Do what you want.
Okay. But here's the deal. Your whole labor, through every contraction, you should be breathing long, slow, deep breaths. It's in the really long, slow, deep breaths that you're getting the oxygen to your baby. You're calming your body down. You're keeping yourself relaxed. So all of this whole time that you've been in labor, you've been breathing, and it's been relaxing, and it's been good. And now baby's right here in the crotch, and you're basically sitting on a baby's head, and you're deciding to hold your breath. And usually, from what we learned, that as soon as you hold your breath, things start to tense up. And so, and especially if you're tensing up your jaw, you might know this, you might not, I don't know, but if there has been studies, and the mouth and jaw and neck are directly linked and related to the perineum and the vagina and all things reproduction.
So you keep this soft,
if you keep this soft and open, so
this will be soft and open.
And so if you're holding your breath, but continue to, again, keep this soft, like you might be holding your breath, but just imagine keep a focus on your jaw and your neck, that it's really soft, but you can continue to breathe and bear down at the same time. So if you take a big breath in, and then as you exhale, if you imagine your throat, I imagine that my throat is like a six lane freeway. We are talking like it's huge. There's not a single car on the freeway of my neck. And I imagine all the breath rushing down that freeway like a tornado, right? Like it's in, and then like you're all the breath. Okay, I'm going to do it without talking.
Can you hear it?
If it's like through your open throat down, and you're directing all that breath down and then between your legs. And again, you can continue to breathe, because that will keep things a lot softer. But at the same time, you can still bear down.
Yes.
Still push. You have
you're directing that breath,
but still push with it.
Yeah, it's an interesting and it's you have to practice it.
Yeah.
Now, sorry, do you have more?
No, with a bowel movement.
Oh yeah, with a bowel movement is the best, honestly.
But I do want to say, if you have been pushing, like the force pushing, the hold your breath pushing into your chest, and you're not getting very far, try breathing through it.
Just directing that breath, opening that throat,
and continuing to breathe. Because sometimes it might be what, if it's been a while and you're still having a hard time getting your baby out. Well, there's lots of things to do, like change positions is a huge one. You should change positions. You should, but continue to breathe. Because if you take a big breath in and hold your breath, that's tensing. Or if you notice that when you hold your breath, you're not feeling it between your legs, you're feeling it on the sides, you're feeling it in your head. I had one mom that was like, she pushed, and then she after she pushed, she dropped her head back. She's like, I feel like my eyes are gonna pop out of my head. And I'm like, whoa, okay, we're definitely not in the right place if we're feeling like all the pressure here. Should be
everything should be directed down. So the breath that she's talking about for pushing, a pushing breath, that is similar to an ujjayi. If anyone does yoga or pranayama practice, it's a similar ujjayi. So it's not constricting the throat, but that sound, you're using the larynx to vibrate and to direct your breath. And it's actually super stimulating to the vagus nerve. That's what's stimulating the vagus nerve. Ujjayi.
And everything's connecting itself.
And everything's connecting itself.
And it's awesome.
And everything is always connecting itself, you guys.
It's so cool. Okay, let's see.
Our bodies are amazing.
Okay. I feel like we missed a few. Love watching these lives and learning so much information.
Thanks.
That was helpful.
Fun. We love it.
I'm pregnant. Thank you for sharing your passion. You guys are the best. Thank you. It's crazy. This makes me want to have another baby. I know, Olivia, you just had one too. So
8.5 months, right?
What? It's already been 8.5 months?
I know. Time flies. So crazy.
We met Olivia here. I want you guys to know.
Have we been doing this for
we have never
months?
met Olivia, but just through this, and we just feel connected to all of you. Anyone else trying to do this right now? Yeah. Thank you. Are you doing it with us?
And you can practice that. You can practice that breath for your pushing. That's just directing down your pushing. So another,
this is interesting. Ashley said, I tended to make some weird high-pitched sounds, and my doula was very good at coaching my husband to make it low and deep sounds. Looking back, doing that helped me to relax my jaw. Yes. Okay. I want to explain that a little bit more. Low and deep is actually a primal thing, and it helps to facilitate what you're trying to do, especially when you're pushing. So you'll notice.
Sorry, can I just say, if you think about tones, so if there's any musicians out here, tones, a low tone is down here, and a high tone is up here.
And in your head.
So your vibration, you are sending out a vibration, and that low vibration is timbering down your body and out where you want your baby to come.
Isn't that so cool?
Versus timbering up in your head, not where you want to go.
So it is interesting, and I'm so glad your doula was there to tell you to keep it low, because it is in the high-pitched noises that your breathing changes into hysterical, and
you stop breathing,
and like the or hyperventilating.
Yeah.
And it's like you get moms who go higher typically get hysterical, and they are like in need of oxygen.
Yeah.
Because they're shallow breathing. So if that makes sense. Does that make sense?
Maybe.
Thinking about taking a cold shower after this.
Yeah, take a cold shower.
I wish I'd have known this. I burst so many blood vessels in my face and neck during my hour of pushing.
Bursting blood vessels in your face and neck is common because you're pushing and holding your breath, and then
in your head,
and it stops here instead of low, deep, slow breaths down.
Oh, okay. So we've got 32 weeks and diagnosed with preeclampsia, and we'll be in the hospital until baby comes. Any advice for delivery with preeclampsia, C-section, or vaginal? So not sure like how you're going to deliver, but you do have preeclampsia. Okay, we're gonna have to do a little bit of research. I know some, but I would like to know. I'd like to be more.
Right. There's more information. Here's something that you can do. So preeclampsia is a lot to do with high blood pressure, and high blood pressure can be lowered with breathing techniques. So your 32 weeks, that's perfect. That's a perfect time to start deep breathing techniques. So one that I'll teach you right now is just, you're going to lay on your belly, on your back, put some pillows up here. You're going to get really comfortable. And you're going to put your hands on your belly, and you're going to count to just as slow as you want. So like 4, or if you have a little bit more lung capacity, you might get to an 8, but you're going to fill your belly up as you inhale, and then slowly it will come back towards your spinal cord, and your pelvis will kind of tilt.
You pull it in?
Yeah, pull it in as you breathe out, as you exhale. So inhale, big, and exhale down.
So it shouldn't be in your chest at all. It's all
it's all in your belly.
All in your belly. So which you have a baby in there, so it probably will feel weird and like you're not doing it, but
you'll feel it. Even with your baby there, you'll feel it, and your baby will love it. It's like a little ride. It's like a jumpy house, because they're like jumping on you. So that's abdominal breathing, and I want to make this as simple as possible. And what that looks like is you're going to breathe in as slowly as you can, hold it for 1 or 2 seconds, and breathe out as slowly as you can. There are a lot of breathing techniques. There are times like 4, 7, 8. Like you breathe in for 4, 7, hold for 7, breathe out for 8. But when you're pregnant, we don't want you to hold your breath that long. And we don't want to, like 2 or 3 seconds is really all. You don't want to be winded. You want to be relaxed.
Yeah, it should be to the point of comfort, not necessarily like.
And so you might be able to handle this breathing exercise for 2 minutes, and do it. If you can do it for 2 minutes for twice a day, so good. And then maybe in a couple weeks, you can do it for 3 minutes, and then you can do it for 5 minutes. So just this abdominal breath. And there's 100 other things. If you want to look up pranayama breathing, there's a nostril technique that's awesome. It's so good. It's like this. You breathe in through your nostril and out through your nostril. Then you breathe in through your nostril and out through your nostril. And you just do this. And part of the benefit is you can't help but relax. You can't help but stay in the present moment, and you are just getting tons of oxygen to your body. So, and that will reduce your blood pressure, and then hopefully it will help manage your symptoms of preeclampsia.
Especially where they are like taking your, I know for me, my blood pressure always went up when I knew that they were going to take my blood pressure, right? Because that, like, again, our bodies are connected. Our mind, we're like, oh no, I've got to perform. I've got to have a certain number on
this. Is when you do your deep breathing.
And so do the deep breathing, definitely. And yes, hopefully that can help manage your symptoms as well. I'm sorry that you're in the hospital, though. That and we really stinks.
I mean, we know lots of information about preeclampsia. It's just how to present it to
in a digestible way.
Well, and not only digestible, but helpful.
Yeah, that's a good point.
We'll work on that.
Okay, Whitney said, any tips to help ease anxiety thinking about going into labor? Got the breathing down, but still feeling anxious despite it being my 4th unmedicated delivery.
Ooh, good. 4th unmedicated. Okay, so sometimes because you've had so many unmedicated deliveries, it's almost like muscle memory. Like, it's all coming back to you. It's all coming back to you now. In the moment of God. And there were flashes of light. Anyone?
Celine. I had a roommate in college that loved Celine Dion, and she made us call her Celine.
She did.
Even though her name was Megan.
Oh, Megan, you're weird. Just kidding. Okay, sorry. Squirrel. What was the question?
The anxiety. She has anxiety.
Anxiety. If you want to listen to us sing, that would help. Maybe. Anyway, breathing techniques are really good, but relaxing with guided or visual imagery. Like, that's going to be your best friend.
You can do this yourself. And I can't tell you how many times we have had women DM us and been like, I'm
having
super
anxiety.
Stressed out. My baby isn't here yet. I'm like every scenario, and it usually just stems down to the anxiety and the stress out. So what a great visualization you can do is find a quiet moment. Take some slow, deep breaths.
Yes,
calm your body. And then very quickly, we actually have one of these in our course.
Yeah, it's one of our course. We have several. We have lots of these. But this is one of them.
But you'll want to imagine you go inside to your baby.
Yeah.
And go in.
And so in your mind's eye, see your baby.
See your baby. And you can even go into your womb, and you can sit with your baby and hold your baby. And you can just say, hey, I'm so nervous about this. How are you feeling about it? I know that we're going to get through it, but it's like, I always get a little nervous to how it's going to go down, and it's going to, this is how I want it to go. And it, describe to your baby how you want it to be. Yeah. And imagine,
imagine that you can feel the baby's weight on your arms, and
the
as
smell, your nose, and then the hair tickles your face.
Yes, and as you are visualizing your ideal birth, you're feeling and you're smelling and you're hearing all the parts of having an ideal birth, and creating this moment and this sensory experience while holding your baby all in your mind.
And then think about you going into labor. Imagine, honestly, imagine your ideal birth. Yeah. What time of day is it? What happens when you feel your first contraction? Is it in the middle of the night? Do you wake up? Is it in the middle of the day? Yeah. Do you continue to go about your day? Imagine it.
Are you wanting to get in the tub? Feel yourself getting into the water and feeling that weightlessness of the warm and that comforting feeling around your belly. Are you going to
are you turning down the lights? Yeah. And is it in the middle of the night? Or is it can you see your husband there and the people that are going to be with you during your birth? And are you moving around? Are you up against the couch or on the bed? Or where are you in your kitchen? Have you gone to when do you go to the hospital?
See yourself in the hospital.
Do yourself, visualize the whole thing, and then imagine the birth, and then just imagine your baby outside now and holding your baby and talking to them and saying, oh, we did it. It was so great. It was a wonderful birth. I love it so much.
Feel those feelings of
I did it.
You did it.
I did it. And it was exactly how I wanted it to be. And you just get to feel that feeling now.
and it's you feel, so your body just thinking and feeling that confidence and that feeling of euphoria that you did it. And that not only did you do it, but you did it with your baby, and you knew it was gonna, you knew everything that was gonna happen, and it was all there. So your mind doesn't know imaginary from reality. So you are actually throwing off tons of oxytocin
and endorphins and all the things that help you feel good. And that's where you want to be. Like, if you think about it, and I know it's not gonna, you might think like, oh, it's not going to play out like that. I don't want to get my hopes up. It's not about getting your hopes up. It's about changing the way it's shifting the anxiety away from anxiety to confident and calm, and it feels good.
It feels good. So,
and that again, that changes all the chemical makeup in your body.
And you're giving your system a break you're giving your sympathetic system a break. Basically, you're going into a parasympathetic state, and you're practicing that. You're practicing going into a parasympathetic state. When you feel anxious, you're going to calm, and then your body, when you feel anxious, will almost like reactionary go back into calm.
Yeah.
So, and then, you'll go back and forth all day, every day. That's just how we're wired.
Again, the more you practice with it, the easier it will be, and the less time that you need to spend in the visualization. It's more just like, okay, I'm feeling like the yucky in my stomach, and my chest is starting to constrict. I'm going to just take a few minutes to take a few deep breaths, and I got to connect to my baby. I got to think this one through and fill it out, and imagine it over. Maybe that's what you really love, is the part where it's just like you are looking at your baby and seeing them in detail and imagining them the way that they are in your head.
Love that. So you might not need to go through the whole birth process, the ideal birth process. I would recommend doing it one or two times, but maybe if you go immediately to your baby and you hold that baby, and your whole sensory experience in your mind is after the baby is here, and those feelings that you feel for your baby and your husband and your care provider and your doula and your baby and yourself, and just all those feelings. And then again, you're just conditioning your mind and your body to do that.
Mm-hmm. So, okay, any words of wisdom for back labor? Do any time with my third, and have been dreaming or dreading the thought of that. Was that way with both of my other babies?
Counter pressure.
Did you? Okay, so that
we've done counter pressure.
Did you, Brevi? I forgot your name. I know you've told us it before. I gotta write it down. I apologize. But we recognize your handle.
Yes, we do.
Yeah. Did you use counter pressure on your back? Usually back labor means that the baby is not in optimal position. Mm-hmm. I would check out spinningbabies.com. They are masters at shifting and changing babies. I'm telling you, we're like mamas in labor on their heads, essentially, to get babies in a correct and optimal position so that it will be a much easier birth.
Things will go smoothly.
And even like, there's this one maneuver. It's amazing. They know all of the things. So go to spinningbabies.com, and getting the baby in optimal position will be a huge help, because again, if you're feeling any like pain radiating down your legs or any intense back labor, that usually means that the baby is, because what's happening is, okay, here's my
Sorry,
spine.
We're going so late.
I know, and this is like not even breathing, but you guys have some really good questions.
Yeah, you do.
And so if your baby, so this is your baby's face, okay? So if they're down here, so if this is their back, then this is an anterior position. This is the position you want them to in. And as they are swirling down, they're actually using their back to move down. So if you have a baby that's not in a great position, they're still moving down, and then you're feeling it all against your spine and your back and your hard spine bones. And that, guess what? That sacrum is not a bendy bone. That does, like, where your pelvis moves and is actually not a full circle, your sacrum is not.
It doesn't move.
So having that up against that is not a baby.
So in the meantime, before you can get to spinning babies, do hands and knees or bum in the air. That's really good for now. Position. And then I don't know how many weeks you are. You're due anytime. Darn it. Our course, we go into great detail about comfort measures and repositioning babies. So spinning babies is a good resource.
Brianne, thank you.
Thanks, Brianne.
And Becca gets me labor too. I used one of the percussion massage guns during my labor, and holy moly, it was a game changer. Nice.
I gotta look into that. I have one of those.
It didn't change my game with how my baby came out, but it helped my labor pain and made it tolerable. I love that.
I love it. You guys have the best questions. Good luck with everybody having their babies in the next few minutes.
I know.
There's a lot of you.
Please let us know how it goes. Even if it's not what you anticipated or what you think we want to hear, like, please know.
We want to hear about it.
We want to hear about it.
Ashley will tell you. We get so excited. And actually, we're going to, we want to do this Feature Friday thing. So Ashley has given us permission to share a little bit of her story and her pictures
and her stories.
So we love doing that because it's inspiring to everyone. So look for that. So send us your, even if you had your baby already 10 years ago, whatever, send us some
We'd love to feature you.
We love birth stories. And so does everyone else. Like we all love to know kind of what happened and the positives and the things that didn't go quite so well, or things that didn't, what
you might want to change, or
things that you learned, things like that.
Things that you learned. I love that.
Anyway,
we love you guys. For you, because like I didn't know about that.
The percsion gun.
Yeah,
oh my gosh,
that's
or whatever that is. I have one of those. Okay, so to this week's giveaway. Oh yeah, because we are going so over on time. And we forgot.
I forgot.
Okay, guess what? Because we talked about breath. Just DM us. DM us your birth stories. Just in the DMs. Thank you. So we were talking, our giveaway this week is a plant.
Like a live one.
A live one delivered to your door.
You a plant.
Because it's oxygen. And breath is all about oxygen. And we just, and I don't know, I feel
like
more
alive.
A house plant.
You can keep it in your house.
Yeah. Like a it's not a succulent.
No, but the one we picked said, it specifically said it cleans the air.
It cleans the air. It's an air cleaner, and I forgot the name of it. But
too.
It's easy to keep alive, and it will be shipped to your door, and it will clean your air. And when you do your deep breathing exercises, and you fill your breath with oxygen,
maybe you make yourself a little corner with your plant and some pillows, and that's your breathing space.
And I don't know if you guys love plants, but we love plants. So
I never thought I used to be able to keep them alive. But I've done really good.
Yeah, it's because we love them, and you send them lots of good energy, and anything's going to thrive when you send it good energy.
That's true.
Anyway, we love you guys. And so comment on this. You have 24 hours. Comment, and we love you. Give us a DM, and we'll pick a winner on Thursday, and we'll send this all in an email.
Yes.
Yay!
Yes, I will.
Okay.
Okay, have a good one.
Good night. Okay, you go there. Good night.
Good night.